Okay, so I want to take you through the various types of prosthetics. There are many types and combinations of prosthetics that are out there, but I want to take you through the three most popular that are in the marketplace today so that you understand the pros and cons of each of these different prosthetic types. Okay, so when you're looking at full arch dentistry, again, you have many prosthetic options in terms of what goes on top of those dental implants. And what I want to focus on here today are the three most common, which are these three. You got the Onyx, which is a print, a PMMA, which is milled, and then you have the ultra hard milled zirconia, which is what people usually go to as finals. I'm going to take you through each one of these and tell you what the pros and cons are for each particular procedure. The Onyx is the first one, and it's a printed prosthetic, which is super accurate. These printers have gotten really, really good lately. So the accuracy on these are down to the nanometer, which is really, really good. They also look natural and beautiful. They're aesthetically pleasing. They look just like real teeth. They're fast. They can print in an hour. And the total production time is about 2 to 3 hours to get everything done. And usually these are used as temporary teeth before they put something more permanent on there. Usually they start with the Onyx and then they move over to the Zirconia. The cons to these are, their maximum dependability is about 6 months to a year. So not very long in terms of the dependability of those. They are going to break. They are going to wear down. They break easily, especially if you grind or you chew on something that's hard, it will break. And the challenge with it, when it does break, it can hang on a single implant or two implants. And any of those micro movements on that prosthetic, when you're talking or chewing or eating, anything that makes that prosthetic wiggle can cause implant failure during your healing process. The next one is called the PMMA. It's a milled prosthetic. Beautiful, natural ceramic teeth. It looks really good. It looks like real teeth. It can last up to 2 to 5 years, but it will wear down, just like the Onyx will. It doesn't also have that translucency that the Zirconia has, but it can be milled in about 3 hours. So you can do this one pretty quickly too. You can mill it out. Total production time, probably 5 to 6 hours on this one. And it's not as expensive as the Zirconia. So you can have a little bit longer lifespan than the Onyx. But the problem with this one is that they're not as aesthetically pleasing as the Zirconia. So you can't get that translucency. You don't get that in the Onyx either. So the Zirconia is going to look much nicer and more natural. It can also break pretty easily. It still has a pressure point of about 300. So it's a little bit stronger than the Onyx stuff too, but it can break rather easily. And that also can lead to implant failure. So anytime you have a broken prosthetic that's hanging onto one implant, creating micro movements, it's not solid and tight, it can create implant failure, which means you have to go back for another surgery. And to me, that's one of the worst things you can do to a patient is to send them back into surgery. It's not unavoidable in every case. Sometimes it has to happen because maybe your body rejects it. Maybe something happens in the process and gets infected. So implant failure is not 100% avoidable, but you want to do the best you can to avoid it as much as possible. So we actually only go straight into the Zirconia. So the nice thing about the Zirconia is that it's beautiful and translucent, which means it looks just like real teeth. The other really cool thing about it is that it's so strong and durable. This one is going to last you the rest of your life as long as you don't crack it. Because it's so strong and rigid, it doesn't bend. So there are some challenges to this breaking, but it can last you the rest of your life. And it's such a great prosthetic. The only cons to this one is that under a lot of pressure, like I was saying, it can crack, it can break. But we only use this one because, especially during healing, you want that prosthetic to be so strong and so tight to the implants. There's no break, there's no snap, there's nothing hanging onto an implant. That way, those implants can heal in a safe environment that doesn't move. You want as little movement as possible on your prosthetic to let those implants heal and osseointegrate over that 3 to 4 month period right after surgery. So that's why we use the Zirconia. And I want to show you exactly what they look like in the patient's mouth so you can see the Onyx Tough 2, the PMMA hybrid, and the Zirconia. And you can see that the Zirconia over here, it just looks so much more natural and beautiful. You can see that the teeth have little bits of translucency to them. These don't have that. Still, obviously, comparing them to the before pictures, they still look amazing and really, really nice for the patient. But This one's just a cut above all the other ones. You can see that it just looks really, really nice. This Zirconia is the only thing that we utilize here at Teeth+Robots, and it's beautiful. And I do want to show you a couple before and after pictures of some of our patients here. And you can just see how amazing their smile transformations look and what we're going for in terms of getting you some new teeth and a beautiful new smile that you can feel amazing about. All right, let me know if you have any questions, and we'll see you on the next video.